Hello friends, myself Dr.Himani R Gupta welcome you to my YouTube channel of my Mother and Care Clinic. Friends, we have heard and read a lot about anemia in pregnancy. We all know that deficiency of iron will lead to anemia, how to diagnose it and how to treat it. But there are other reasons of anemia too, which are caused by dietary deficiency, and we should know about them too. Are you familiar with the term megaloblastic anemia? This type of anemia is caused by deficiency of two kinds of vitamins, that are folic acid and vitamin B12. Now, why should a vitamin deficiency cause anemia? Anemia simply means that the hemoglobin present in the red blood cells is not working properly. And why should this hemoglobin not work properly? Because the DNA structure of the hemoglobin is faulty. But why is the DNA structure faulty? Because folic acid and vitamin B12, which facilitate the normal building blocks formation of DNA, are in inadequate quantity. Because of this, there is deficiency of wanted nucleic acid, which is known as thymine, and abundance of unwanted nucleic acid, which is known as uracil. When this uracil gets incorporated into the hemoglobin structure, this hemoglobin cannot work properly, and body's natural immune system start working against these abnormal red blood cells. In the bone marrow, where these red blood cells are actually formed, the maturation cycle is not complete. These immature cells contain immature DNA, which look very big in size, hence the name megaloblastic anemia. Pregnant women with megaloblastic anemia present with fatigue, lethargy, weakness, breathlessness, pallor, change of hair color, glossitis, hyperpigmentation of skin and nails, etc. Gastrointestinal system related symptoms include nausea, vomiting, diarrhea, gastritis. Nervous system also gets affected. The protective sheath of nerve fibers become defective, and this condition is known as demyelination. The neurological symptoms mostly affect the lower limbs, and the symptoms include numbness, tingling, altered sensation, muscle weakness, and gait abnormalities. What are the reasons for developing megaloblastic anemia? In the case of folic acid deficiency, the reasons include malnutrition, alcohol consumption, and malnutrition syndromes like Crohn's disease, celiac disease, Whipple disease, amyloidosis, diabetes mellitus, and small bowel resection. Long-term taking of certain medicines like phenytoin, valproic acid, pyrimethamine, and antiviral drugs also can lead to folic acid deficiency. Vitamin B12 deficiency in pregnant women is mostly related to those women who are on strict vegetarian diet or who have got gastric infection with a bacteria known as H. pylori. There are some common reasons also which can cause both deficiency of folic acid as well as vitamin B12. These include liver disease, severe hemolytic diseases. Now, how to diagnose these kind of anemia? The simplest way is the examination of peripheral blood smear. This peripheral blood smear will reveal giant neutrophils which have a DNA which has more than 4 to 5 lobes. The RBCs are nucleated and there is a varying degree of leukopenia and thrombocytopenia. Serum levels of folic acid, vitamin B12 and methylmalonic acid are low. Serum levels of LDH are increased because ineffective erythropoiesis leads to increased levels of hemolysis. We must also remember that iron deficiency anemia may coexist with megaloblastic anemia. Now we will discuss what are the effects of folic acid deficiency on the pregnancy. Folic acid deficiency can lead to many complications in the pregnant woman like spontaneous abortion, recurrent pregnancy loss, preterm delivery, abruptio placentae, preeclampsia and intrauterine growth retardation. And what are the effects of folic acid deficiency on the fetus? Folic acid is very important for the normal development and formation of fetus. Its deficiency leads to neural tube defects in the fetus, which means that the spinal column or spinal cord is not formed properly and there are abnormalities in it. Apart from it, there can be heart defects and orofacial defects too. These defects can simply be avoided by starting folic acid supplementation in pre-pregnancy period. Anyways, as soon as the pregnancy is started and first antenatal visit is made to the gynecologist, the folic acid supplementation is started by the doctor itself. To correct vitamin B12 deficiency, initially intramuscular or intravenous injections are given and subsequently oral medications are prescribed for a couple of months. It is also very important to recognize if iron deficiency also coexist and start the iron supplementation too. Otherwise, the anemia will not get corrected. So friends, keep watching my YouTube channel of my Mother and Care Clinic to know more about women and health related videos. Share, like and subscribe. Thank you.